All right, welcome back to the Now Morning Show here on CTT. I am Natalie Legore, and in studio with me at this time is the Minister of Health, the Honorable Terence Dial Singh. And of course, you know, the focus is on vaccination. Where are we? Or as most of you have been asking, why is it that Trinidad and Tobago seems to be lagging behind the rest of the Caribbean in getting vaccines into this country? Good morning to you,
Morning,
Minister.
Natalie. Morning.
Thank you so much for being with us here this morning.
Thank you very
much. Why are we lagging behind? That's the general belief, that we're lagging behind other Caribbean islands. We saw Jamaica got 14,000 plus vaccines yesterday. Why is Trinidad and Tobago behind?
For several reasons. One, we have taken a position and we have been consistent that we will only be using WHO-approved vaccines. Some Caribbean countries, as is their right as a sovereign state, have decided to do otherwise. That's one reason. WHO to date has only approved 3 vaccines. The Pfizer vaccine approved on January 31st, the AstraZeneca on February 15th, just 1 month old, and Johnson & Johnson last Friday. That's 4 days. So it means our pool of available vaccines is limited to now 3, 1 being approved just 4 days ago. 2, if you, Natalie, were the administrator of the COVAX program, and you have 2 countries to send doses to, country A, like Trinidad and Tobago, where the rolling 7-day average is 3, 4, and 5, versus country B,
like Jamaica.
I am not calling any countries' names. I have never done that. Or country B, where the death rate is high, where the case fatality rate is high, where the number of cases are high. Which country are you going to send the vaccines to?
Well, naturally, I can understand the thought process behind that. But let us explore what you said, that there are 3 vaccines approved. The reality is that Barbados, Dominica, I think St. Lucia, St. Vincent, and the Grenadines, they got vaccine from the Oxford AstraZeneca vaccines. And Barbados was kind enough to share that with Trinidad and Tobago. So we are talking about something or a vaccine that has been approved by the WHO.
No, Natalie. When we got the gift from Barbados, we got it on February the 12th. We had to keep it until February the 15th when it was approved. It is only when it was approved on Monday, February 15th, that we started to shoot it into arms on Wednesday, February 15th. 17th, sorry, yeah.
Right. So you all wanted to ensure that it was approved before usage.
Correct.
But what about, so is it that, because one of the arguments as well, especially from the United National Congress, is why is it that Trinidad and Tobago didn't write to India? We have a good diplomatic relationship as far as we're aware, to ask for these vaccines, because just as it happened, it got approved.
I will ask you to hold on that discussion for a couple of days. What I can tell you is that we were in talks with many firms and countries before that. But I will ask you to hold your fire on that for a couple of days. I think things will become clearer.
So as if that we're missing a little part of the puzzle.
Look, this whole vaccine thing, without mentioning any country, not even India, this whole vaccine thing has been politicized to a very high degree, not only in Trinidad and Tobago, abroad. You would see where Italy took a decision to embargo a shipment of 400,000 doses of AstraZeneca vaccine bound for Australia. Many countries are embargoing their vaccines to protect their local population first. That is what is happening. The COVAX principle was based on equity and so on, and
it has not worked.
It has not worked. But we have been in bilateral talks with countries and manufacturers formally since October the 1st, 2020.
Was India included in that?
At that time, no. The countries that were willing to speak to us at that time would have been China. They were speaking to us, and different manufacturers. I myself spoke at that time to Sinopharm, so I can tell you that with a degree of certainty. But Natalie, what is going to happen from around May? You are going to see a freeing up of the system from around May for two reasons. One, more and more vaccines are going to be WHO approved. So it means Trinidad and Tobago, that has this principle of safety over expediency, will have more access to vaccines. And two, as the larger countries, especially United States, Canada, England, and so on, as they vaccinate their population, more and more vaccines will become available to countries like us.
Right. So then the COVAX facility has definitely failed, because that's what people wanted to avoid, where rich countries would hoard vaccines or get vaccines, and then smaller island states would just suffer. But here we are.
Correct. And we are going, I think countries like us, I understand the anxiety. I understand it. I mean, I appreciate it. But because of these public health measures, Trinidad and Tobago has done remarkably well in managing the virus. Our caseload is so low that, you know, we are not a priority for vaccines. The priority right now are those countries that have total uncontrolled spread. And I can understand that from a managerial perspective if I was managing COVAX. But I understand the anxiety, and what I will tell the country, we should be getting our initial doses of 33,000 from COVAX by the end of March. I have been literally harassing PAHO both in Trinidad and Washington on a daily basis. And by around May, end of April, May, things are going to free up around the world. So let us get over this hump. Let us get over this period of anxiety. But I want the population to know our principle is not expediency, but safety.
Why was the initial amount of doses from COVAX reduced from 100,000+ to 30,000?
So when COVAX first wrote us, and which I said on a press conference, and which Dr. Wheeler said, that 100,000 was to take us from March into May, right? So March into May. What they have done, because of global supply challenges, is split the shipment into two. 33,000 and then 77,000. So we are still getting the targeted amount over the targeted period. But instead of getting it in one big shipment, they're going to split it into 33 and 77. And that is what has created the anxiety, which I appreciate.
At this point, Minister, are we even certain that we will get these vaccines by the end of March?
In all my talks to PAHO, both in Trinidad and Tobago and Washington, I spoke to Washington up to yesterday, we seem to be on target for the end of March.
Right.
And once we have it, we are ready to start vaccinating within 3 to 5 days.
Right. And I saw where you mentioned that the population, the country is ready to accept all of these vaccines. So what work was done to ensure that we can house these vaccines?
So prior to COVID-19, we only had capacity to store the normal range of vaccines we will have in the country, MMR, yellow fever, tetanus, and all that. To do a mass vaccination program, you then had to build out not only storage capacity, but also have all your consumables, your health centers ready, training, IT, and all that. So I would have told the country back in November, December, we had to build out a brand new chiller at the Couva Hospital. The Couva Hospital was never built with a chiller. A Riemann Point 14 were. So we built a massive chiller at Couva. I was there on Saturday morning.
Right.
That chiller can hold 1 million doses of vaccines. So I could not have brought in 1 million doses in January. There will be nowhere to put it.
Right.
Right? So we now have that chiller that can hold 1 million doses. In addition to that, across our other facilities, we can hold another 3 to maybe 500,000. So that's a 1.4, 1.5 million. We can store comfortably now. In addition to that, you have to have 1 million syringes.
Right. So I know that you've ordered some of those.
We have 1 million in stock now. We have 1 million coming in on April 30th. You have to have 1 million alcohol wipes.
Yeah.
You have to have we have 21 health centers kitted out to start it. So we're in a good position now to start a very robust vaccination program. The only thing that is missing is getting the WHO approved vaccines in country.
Minister, I must say that I think it was the first day that healthcare workers was vaccinated. I was quite disappointed because I was watching and I saw somebody administering a vaccine without gloves on.
No,
and that took
she had on gloves.
She had a glove?
If you look on, you will see she had on purple gloves. The one who administered the first dose to Nurse Privat, which was Nurse Grace Sukchan, she had on purple gloves. I don't know if there was another shot.
I
can't. That
I'll have to check that again because it's something I see all the time, even in the regular healthcare system, which to me is just wrong.
What I'm saying, Nurse Privat, who was given the first shot, delivered by Nurse Grace Sukchan. If you look at that shot, you will see Nurse Grace Sukchan have on purple gloves. I'm not saying there may be other shots of other people.
Who didn't have one.
But that was done by North Central RHA. The Minister of Health does not get involved in these very important details. Okay.
Well, let's talk about what you can get involved in, because I know that there are concerns about, who will be taking the vaccine, who may not want to take the vaccine. And I think even at this point, there are still concerns. Just the fact that we've never seen vaccines developed so rapidly. We've never seen, so much, maybe it's misinformation, maybe it's
a lot of that. It's a lot of that.
There might be a lot of misinformation, but there was a lot of... There was also a lot of hiding of details. So when people feel as if they can't get, like to this day, I don't know if it's ever been agreed on as to how we got COVID-19 in the first place. And when you have that kind of uncertainty, it does create a backlash where people are like, okay, if you're not honest with me, or if I don't know, then I'm going to doubt everything then, as compared to just that. So again, and I think this is a question that has been put to you many times, how do you treat with that for these people who may still be doubtful, may still be questioning whether or not this is something for them?
Okay. So you want to talk specifically about why the vaccine was developed so quickly? Is that the gist of the question?
I am always curious about that.
Okay.
Because I think that's one of the arguments by people as to doubting not only its efficacy or how reliable it is, but whether or not they should take it.
So a new vaccine normally takes 5, 10, 20 years to develop, depending on how complex it is and so on. With COVAX, one has to remember that research was already being done into MERS and SARS, which is related to COVID-19. That is why the virus is called the SARS-CoV virus. SARS has been around since 2002. So research was already done for the past 18 years into SARS. The virus is called the SARS-CoV virus. So there's a body of work already done into the SARS virus. Two of the things that hampers vaccine manufacturing, one is finance, and two, clinical trials, where you do clinical trials sequentially, pre-phase 1, phase 1, phase 2, phase 3. When you are developing a new vaccine, you have to apply for grants, government funding, and that could take years. In the case of COVID, the countries pulled together under COVAX, and this is where COVAX worked. I don't want people to think COVAX has been a failure.
No, I did speak to Dr. Wheeler about that. I just thought that...
COVAX worked because 170-something countries around the world pooled financial resources. So you didn't have the financial constraints to start developing a vaccine. Trinidad and Tobago, towards that effort, paid $1.477 million into the research. So finance was not an issue. Then what you started happening was, instead of doing the trials sequentially, phase 1, phase 2, phase 3, a lot of these were done simultaneously on large groups of people. The data was always scrupulously measured, looked at, interrogated. And that is the key to safety. What has happened also is that a vaccine manufacturer typically will wait until you get approval to manufacture large doses. What happened in this case is that as the trials showed promise, millions and millions of doses were manufactured pending approval. So once you had approval, you did not start to manufacture. You already had millions of doses. So those were three of the main reasons why this particular vaccine was able to be manufactured safely in such a short period of time.
I guess now we can have hope for things like HIV and AIDS, because now we recognize that countries can really pull together and get results. So if for the next 5 years I don't see any other vaccine to treat with issues that are killing people daily, then I'll know that is just a lack of will.
Yeah. But the thing with HIV and AIDS, they have developed therapeutics now, drugs, that HIV and AIDS is no longer a death sentence. So, but that's another story.
Right, because the thing is that that's not what people want. People don't want to be with a virus that says, okay, you won't die, but you live with it, and you know.
So it can be done, and that is where COVAX was brilliant in pooling resources, right, and getting this vaccine to market as quickly as possible. What has not worked with COVAX is the equitable distribution of vaccines.
How many people do you think the Ministry of Health will be able to vaccinate daily based on what has been happening now?
We are doing our scenarios on that. We could vaccinate about 1,000 persons a day easily, and that could be ramped up.
Right. And I was curious as well about the 2,000 vaccines donated from Barbados. I thought that it was just going to vaccinate 1,000 people to give them their first dose, then their second dose. Now I realize that they're just distributing it to 2,000 people, because I think... No, they're still doing the first and second dose for those people?
Yes, so we have those doses in reserve for those persons who got their first shot to get their second shot 8 to 12 weeks apart.
But I thought I saw at one of those press conferences Dr. Hines say that 1,100 people have been vaccinated.
And I explained that. What we found, so each vial is supposed to have 10 doses. When we started to administer, we found that we were getting 11 doses out of each vial, which was the same thing found in the United States last year when they started. So that is why we were able to go another 100.
Right. Okay.
Plus.
All right, so they'll get their second dose. Have they started getting their second dose?
No, because 8 to 12 weeks has not elapsed.
I thought it was 3 weeks.
No, it is the current... Months ago, the current thinking at that time was 2 to 3 weeks. But like everything with COVID-19, we always say the current thinking, all things being equal, because things change on us. The current thinking is that you administer it 8 to 12 weeks. What the research has shown, the longer you wait, you seem to get, the second dose seems to be much more effective.
Okay.
Than giving it too soon.
Too close, right. All right, well, that's interesting. I'm happy to hear that. So I await for the vaccination rollout. But as I said, let's talk about those anti-vaxxers, so to speak. Sure. You know, how do you, convince, so to speak? Because if we're talking about herd immunity in some time, to come, how do you convince those people that, okay, to get there, we need the population on board?
Okay. So we start with our healthcare workers. Research has shown us over the years that healthcare workers were some of the more resistant persons to taking vaccines. We did a very aggressive vaccine education program with our nurses and healthcare workers, especially in conjunction with the University of the West Indies, and that has paid dividends. Actually, those first 1,000 persons, we were quite surprised at how healthcare workers were actually asking for the vaccines. So we seem to have gotten over that hurdle. Basically, what healthcare workers were saying, they were waiting for the evidence. We gave them the evidence. They were waiting for the first set of colleagues to take the vaccines. And now I think the resistance amongst healthcare workers has declined considerably. The same thing is going to happen with the population. I think once the population, and I must say, between the university and ourselves and the media, those three parties together have been educating the population. And I must thank the media for this. We have been educating the population. And I am getting calls every day, when am I getting my vaccine? So I don't think the level of vaccine hesitancy is as high as we thought. In countries that actually do polls, like in the United States, you will see the level of vaccine acceptance going up, although there does seem to be a political divide. But generally, the level of vaccine acceptance is going up, and we are seeing the same sort of trends here. Level of vaccine acceptance going up, and level of vaccines hesitancy coming down. But you will never get 100%.
Right. So I know that the government is in talks, according to one of the dailies here this morning, with China. What of the concerns then of, vaccines that aren't approved by the WHO?
Okay. So we have precedent in Trinidad and Tobago by bringing vaccines into the country and waiting for WHO approval, as we did with the gift from Barbados, as we spoke about earlier. That came into the country on around the 12th or 13th. We got approval on these. They were here. We took a position we were not going to administer it until we got WHO approval. We got WHO approval on Monday the 15th, and we started to administer on Wednesday the 17th. We will do the same thing with any other vaccine that stands a very good chance of being WHO approved. There are about 2 or 3 vaccines that are going before the WHO panel that should get signed off by the end of March. My understanding is that Sinopharm is one of them.
Right. So if we get the approval. But, I mean, I remember when we were talking about vaccines that you had said you were going to, you'll be first in line. Yeah. To take this shot, and I know since then you've spoken about, giving healthcare workers a preference.
Because we only got in the 2000.
Right.
Yes.
But was there really any fear on your part to take that jab?
Once it is WHO, you see, I'm a scientist by nature, so I understand the science that goes behind it. I'm a pharmacist, I understand the science that goes behind it. I understand the robustness of the regulatory process. And that is why I have no fear in saying, once I have a WHO-approved vaccine, I will be now second in line, because the Prime Minister said he will be first in line.
Right.
I'll be second in line to take it.
Right.
So when we get in this 33,000 doses of vaccines from WHO, and WHO not only approves the vaccine, they also approve the sites. And this is something that I think that needs repeating. Could you imagine if I had brought in the AstraZeneca vaccine being manufactured in Europe? And you see what is happening in Europe. Could you imagine if in expediency and being accused of lagging Trinidad and Tobago, I have brought in those vaccines from a non-WHO approved site in Europe? What would have been our position in Trinidad and Tobago?
Of course, we know people would have complained and said due diligence wasn't done.
Exactly.
But
So hold on. The AstraZeneca vaccine is approved, but WHO has only approved 2 manufacturing sites, Serum Institute of India and South Korea Bio. They have not approved the other sites in Europe or anywhere else, and that is why Trinidad and Tobago is lagging. We are not going to sacrifice the safety and health of our population for expediency.
How does the COVAX facility and the WHO approve a vaccine but then not approve the site, and suddenly it makes the vaccine not good? Isn't that some kind of contradiction?
No, it's not, because people are assuming we are doing this for the first time. As I explained on the press conference on Monday, all drugs that come into Trinidad and Tobago, you not only approve the drug, we approve the manufacturing site, we approve the label, we approve the formulation. And if a manufacturing site changes from factory A to factory B, that agent has to put in a supplemental registration to show that the new manufacturing site adheres to what is called GMP, good manufacturing practices. This has been going on for decades, but because of the heightened anxiety over COVAX and the vaccine, people think we are doing this for the first time. This is normal practice in Trinidad and Tobago for decades. You not only approve the drug, you approve the manufacturing site, you approve the uses for the drug, and you approve the label, everything.
Minister, we do have to go, but in terms of those who have been vaccinated thus far, have we recorded any adverse effects in any of the people who have taken the jab?
No, you have gotten some side effects as expected, fever, pain at the site and so on, lethargy for 24 to 48 hours, overcome with time and paracetamol, but there have been no adverse effects. And there's a big difference between what is a side effect and an adverse effect. So there have been no adverse effects, but there have been some side effects, as you would expect with any vaccine.
All right, Minister, we do have to leave it there, but thank you so much for speaking with us this morning.
Good, thank you.
The Minister of Health, Terence Dialsing, speaking with us, and he's saying safety before expediency for Trinidad and Tobago. So the vaccines are supposed to be here by the end of the month, and TNT will start its massive or long-term vaccination drive. We take a break and we'll be back.